everyone, Dr. Chris Fox here with the Student Physical Therapist. Today I wanted to go over a couple of exercises for improving and locking in some of the changes of hip flexion mobility that we may have gotten with some of our manual techniques. So go ahead and lay on your back, Brian. So one of the easy ones I like to do is repeated hip flexion. So first, to see if it's necessary, you can just do your assessment to look at end range hip flexion, and you can see Brian is lacking there. You want to be able to get the knee much closer up to the chest there. So what I'll do is I'll have my patients grab either underneath their thigh or in front of their knee and just repeatedly bring their knee up towards their chest like that. And what I'll do is look to see, am I getting a regular improvement in mobility while he's performing it, and then go ahead and relax. Afterwards, I'll reassess as well to see if I'm getting a change in that motion or any pain before the motion as well. With this exercise, I typically like to dose it if it's a really limited factor and I see that it's contributing to the patient. I'll dose it 10 repetitions every hour during that treatment phase, and then as they progress to independent management, I'll transition towards having them do it just if their A, symptoms return, or B, before and after they do some sort of higher level technique like running or playing a pickup game of basketball, something that's more active and challenges their nervous system more. Another technique that I really like, and it helps mobilize the posterior capsule, go ahead and on all fours there, Brian, is the quad rock back exercises. All right, so what I'll do, make sure they're in the 90-90 position here for their hips and knees. So go ahead and scoot the knees a little bit lower. There you go, perfect. All right, so you want to make sure that they maintain a neutral lumbar spine with this, and you're going to have them rock backwards on towards their heels, but trying to get the motion as much as they can from their hips. So go ahead and do that a couple times there, Brian. As soon as they're starting to get a lot of flexion from the lumbar spine, I'll have them stop and come back up to the starting position. Because that longitudinal force is going through the posterior aspect of the capsule, it helps to mobilize it as he moves through the flexion range. Now, sometimes what you'll see in patients with this is they'll complain of pinching in the front of their hips. What you can do to deactivate that is have them instead try and push away with their hands instead, so that they're trying to relax their hip muscles instead. Excellent, good. Now this exercise, I'll probably tell my patients to do maybe a couple sets of 20 throughout the day, like 2 or 3 sets. Thanks, Brian. But again, the more they can do this until they start getting the normal motion, the better. And whatever you can do to lock in the changes is perfect then.